Welcome to Imo CEOs. My name is Linda, and today I'm with Dr. Uwajeh, the Chief Medical Director of Streams of Life Hospital. Good to have you, ma.
It's my pleasure.
Ma, please, can you tell us about yourself?
I'm Dr. Chinenye Uwajeh. I'm a co-founder of Streams of Life Hospital. I'm a medical doctor by profession and the Chief Medical Director of Streams of Life Hospital. I'm from River State, married to Delta State. I trained in University of Port Harcourt. I'm married, happily married with two lovely boys.
You're from River State, married to Delta State. What is the connection? How did you meet your husband? I mean, where did you guys meet?
Okay, we met in Owerri. I actually am born and bred in Port Harcourt, and my husband born and bred in Lagos. And we met here in Owerri and decided to settle because Owerri is quite peaceful.
Wow. So, being the Chief Medical Director, how are you coping? And also a wife and a mother, how are you coping?
It's not an easy task combining motherhood, career, and trying as much as possible to live a good life. But I try as much as possible to draw the line that none is affected. I balance the equation.
Okay. As Chiefs of Life Hospital, what's it all about? What kind of services do you provide at the hospital?
Okay, we are a family-centered hospital. We provide quality medical care to the masses. Why I said we are family-centered is we concentrate on the mother, then eventually we'll get to the children, the father, and every other person. So we'll do our best to make sure that the family is well taken care of.
Okay. Where is it located?
We have two branches. One along Owerri Aba Express Road in Naze precisely. Then the other one by road safety in Egbu.
Okay. When you were growing up, what were your career aspirations? I know many of us normally have something we want to be when we're younger and end up being another thing as an adult. So, what were your career aspirations?
I've always wanted to be a medical doctor. Right from when I heard this poem, Miss Polly had a dolly who was sick, sick, sick. I actually wanted to be that doctor. Although growing up, I had other inspirations. I wanted to be a teacher. I wanted to be a guardian counselor. I'd also wanted to be an artist.
Okay, what inspired you to start up here in a way? Being from Rivers, married to Delta, there's no connection between. You said here in a way. So what's the motivation?
Owerri is quite peaceful. The people are welcoming. And why I actually chose Owerri and the suburb, not just concentrating on the township area, is that quality health care is actually very difficult to reach. Most of them travel a long distance to get quality health care. And most times they might not have the resources to fund quality health care. So I decided that I could reach out to these people of the suburb and try as much as possible to bridge the gap between quality health care and affordability.
What makes your hospital stand out in the market? What is that special thing about the hospital that makes it stand out in the market?
Okay, as I said before, we're family centered. We make sure that we reach out to the family, starting from the mother, then the child, the father, then every other person in the family. And also affordability. We try as much as possible to cut your coat according to both your size and your material to make sure that you get quality. That's why we stand out. We're different, we're concentrated on quality, and we make sure we deliver.
Okay. So, my role as a chief medical director of Upstream Supply Hospital, how do you manage the case of emergencies without deposit?
All right. The Bible says money answereth all things. But we try as much as possible to make sure that with the little you have, we resuscitate and sustain your life first before we can now tell you, okay, call your loved ones, call your family, call your church people, call your friends. But we would want a situation where life is on the forefront. We'll save your life first, then every other thing will be added.
Okay. So, have you been in a situation where you have to compromise, trying to manage what you have to do something?
Yeah, most times some people come and they tell you this is their budget. Meanwhile, what you want to do for them is well encompassing and it would overtake their budget. But we'll try as much as possible to make sure that we talk to you and level down with you to make sure that we work within your budget and make sure we achieve a desirable result. So it happens.
So, what are your personal challenges you face? What's those challenges you face as a director in the hospital, trying to maintain quality healthcare and also seeing that things are going well?
Okay, part of the challenges is our economy. All of us are in the economy together. Some people believe that the health sector should be very humanitarian, but we don't know that we still swim around this economy. So it's difficult to actually go and acquire drugs and other health facilities at peanuts because they actually come believing that we'll be able to do magic. We don't do magic, we don't do miracle. We only do within our limits. Another challenge is some people feel we should sit by our phone and be answering their call anytime. Yes, we're open 24 hours. There are people on duty, but it doesn't mean that the CMD should be on duty. I have a family. Although my husband is a very understanding man and my children are very understanding,
Kudos to them.
yes. But sometimes these patients expect you to wake up in the middle of the night, answer their call, and run down to attend to them. But sometimes it's not feasible. They should put themselves in our shoes. We have a life. I'm still a wife. I cook. I take care of my children. I do a lot. But when I'm on duty, I go all out. Or I put people, capable people, qualified people in the business so that they'll be able to do all I'm supposed to do or all that is required to make sure that you achieve aim. So it's not negligence. Some people complain that it's negligence when you don't pick their call. But I'm sure when you get to the hospital, you get maximum health care, maximum quality health care anytime you get to the hospital. So just reach out to the hospital, not just reaching me on phone. But when you get to the hospital, you get top-notch service.
Okay. So let's talk about the hospital issues. There are some issues that comes to the hospital regularly. Even in the case of a pregnant woman trying to give birth through CS, and CS is the best way for this woman, but she doesn't want CS. So that kind of case can really put you in a tight corner. How do you settle such issues?
Okay, as I said, we're family-centered. At this critical point, the patient might not really understand what is going on. So that's why most times we want family members around, loved ones around, so you'll be able to help convince this
What
patient.
if it's a case of emergency? There's no one there.
Oh, if it's in the case of emergency, we'll do all we can to explain to you. Then you're obliged to make a decision and sign consent for us. Then we'll be able to take action. Because for a doctor to summon courage and tell you, this is it, please listen and actually follow the doctor because they are the ones that are taking care of your health, your life at that point. Sorry to say, but we're not God, but it's in their hands. So If we tell you this is the right thing, this is the right decision to make, you should try and make those decisions. Another problems we have is pastors. They keep calling their pastors and prayer warriors and all, and they discourage them, not knowing what they are actually facing, not knowing what is involved. Some of them have myopic minds that they feel delivery of the Hebrew women should be through CS and should be through normal delivery. It might be through CS, because even the Bible did not record how the delivery went. They just said before we came, they had delivered. It could be any means. So our pastors too, our prayer warriors, our imams, they should please help us and educate these people, because they listen more to them than every other person.
Okay, the case of this economy. I know there are some times when a patient has been treated but has not, been able to fix the financial issues. They'll tend to stay more longer in the hospital. How do you balance this? Like,
Awaiting settlement of bill is an issue. But sometimes philanthropics come through. People come and they just give donations. People come and clear bills. People come maybe as a church to settle patients' bill. Even if they are not capable, they can be able to call on every other person that is around them, the organization they belong to, the clubs they belong to, the age grade they belong to, and sometimes some humans that want to do humanitarian work come around to help settle their bills. So that's how we go by those ASB people.
for how long? What if they don't come?
We're hopeful. We don't just rule it out. Most times they come through for us. And if you're out there and you're willing to help people sacrificially, that's the kind of love that God wants us. He said, when I was sick, did you visit me? When I was in prison, did you visit me? So you could come around and ask. Sometimes we have these patients. So you could ask and help them. And your reward is in heaven.
Yes, exactly. Thank you very much, ma. What advice do you give to upcoming medical personnel, and also kind of what advice do you give to people out there to maintain a good health care?
Okay, let me start from my colleagues that are coming. One of my challenges is I didn't have a mentor while growing up. So I made a lot of mistakes, which I don't wish anybody to do. But I believe that if you stay focused, you would achieve your goal. If you don't put your eyes on the money, every other thing will be added to you. So your focus should be on this humanitarian work, and every other thing will follow. Then for people out there, I would want to say, stay healthy in every way you can. Eat right, exercise, drink a lot of water. And anytime you have symptoms or signs that you don't understand, please come to the hospital. Over-the-counter drug is a no-no. Don't take prescription by yourself or by any other person that is not a professional. Try as much as possible to visit the hospital so that you can be well taken care of. Health, they say, is wealth.
Ma, please, last one. How I'm wondering, how do you manage your staffs? I know that some staffs make so many mistakes and they deal with human lives. When such cases arise, how do you settle it? Do you sack them, or do you give them precautions?
We operate a very sensitive work, and there are no rooms for lapses. That's why most times we'll make sure that it's a professional we are employing, we're hiring. And there are some mistakes that can't be redeemable. So we minimize, or we don't even tolerate any mistakes. Dealing with staffs, there are a lot of issues with staffs. But with the wisdom of God, we deal with them. But if it's for mistakes, unprofessional character, or any vices that will bring down the healthcare, we don't take it.
You don't compromise.
We don't compromise at all.
Thank you very much for your time.
Thank you
It's an
very
honor to
much.
have you here today.
It's a pleasure.
Okay.